An ankle again, yes? We're not going to do that on the upper extremities. We're going to take everything we need at each level as we go. So, first image is what?
Jugular vein with and without comp.
Jugular vein, transverse jugular vein with and without comp, yes?
Yes.
All right, so everybody sees the jugular vein, yes?
Mm-hmm.
Which one is it? Top or bottom? Top or bottom? Who said bottom? Bottom's the artery, yes?
Yeah. You can compress it and find out.
See how we can compress? So we're going to take it transverse, right? Internal jugular vein, or IJV. With or without comp. Okay? We're going to take a color image as well. Be a little bit careful because it's easy to compress, yes?
Mm-hmm.
Take a color, SAG with color. And we're going to take a Doppler. And that's a normal jugular vein waveform. Messy, isn't it?
Yes. Okay.
It's very pulsatile. Why? The carotid's right here and it's banging into the side of it. So you're not going to get your normal phasicity. Why wouldn't you have a phasic waveform? What causes phasicity? Breathing. Okay. More specifically. You're right, breathing. But what about breathing?
Mm-hmm.
The collapse of the expansion of muscles. Is that what you're trying to say?
Mm-hmm.
Okay.
What muscle?
Well, your diaphragm.
Diaphragm.
Yeah.
Is blood going through the jugular vein influenced by the diaphragm?
No.
No, that's the internal, or that's the inferior vena cava,
Yeah.
right?
Yeah.
Jugular vein is dumping into superior vena cava.
Right.
So the contraction of the diaphragm is going to have no effect on this, is it?
Right.
So you're going to see this pulsatile, almost continuous waveform, right? And that's pretty normal.
Okay.
So, all right. Now, what I like to do from here is I like to take, and then we're going to follow this down. Now, you asked about the reference marker. I still have the reference marker facing me. So, it's
Not the patient's
technically backwards. It's not the patient's right.
Right? Huh.
Gotcha.
Okay?
Is it just because of upside down?
It's because I'm on this side. I mean, I can turn it away from me. I mean, we can do that if you want. But
You tell us.
it doesn't, the honest answer is it doesn't matter.
Okay.
Okay?
Okay.
So we're going to follow that jugular vein down. And now we come right over a clavicle, right?
Mm-hmm.
So I'd like to see it come down to the innominate. And there it is right there. See it? This is the innominate. Brachiocephalic. This is the subclavian coming off this way. See that? So if we put color on this, there's the brachiocephalic. Right here. And do we have that on our protocol?
Yeah.
But it's just with color and with waveform, right?
Correct.
So with color, Doppler, do I have to angle correct? Not really, do I? And look at how pulsatile that is. Why? Well, it's dumping right into the right atrium, yes?
Yeah.
It's coming right into the superior vena cava, right into the right atrium. So it's going to be very pulsatile, but normal, yes? And what we're trying to just document is that it's patent.
Okay.
Patency just means what? Patency means what? It's open, right? It means it's open. There's nothing in it. All right, so now we're going to come out and we're going to follow her subclavian. And I'm going to start on top of her clavicle, which, why? Because I can see it, right? But this is going to change for everyone. So there's her proximal subclavian. And why am I not getting any color flow here? Which way is flow going? What's my angle of incidence? 90 degrees, so I'm not getting any color flow, am I? So I'm going to drop down below her clavicle, and I'm going to angle up. I'm going to get a little bit more flow. So proximal. I'm getting a nice normal flow. Yes?
Yep.
I'm going to follow out to distal. Here we're at mid. I'm getting a little bit more color flow here at mid, yes?
Mm-hmm.
Good. And then distal, yes? I'm going to keep following that up. Increase our depth a little bit. And distal, yes? Now, what does it say on there? It says,
Usually they want a compression.
a lot of places going to want a compression at some point, yes? I usually like to do it at mid, and obviously we're going to do this in transverse, right? I'm going to follow this back. Now, if I push, does that hurt?
No.
Do you know how hard I'd have to push to compress it completely?
Yeah.
Do you think it'd hurt?
Yeah.
Do me a favor. Purse your lips and do that. Yep.
Let's take a deep breath.
Purse your lips together, and now suck in air really fast. And it compresses. Okay? So, you don't have to compress it, just have them purse your lips and really fast, and it'll collapse down. We're going to take it with and without compression. Now, axillary. And this is where this exam gets a little bit tricky. Okay. Here's oh,
We can do it.
we can do it. Here's what I like to do. I'm going to take your arm. I'm going to lay it right across my lap. Okay?
Okay.
And this is where you can really adjust the bed to help you. Good. Because I don't want any strain on the arm. I want the muscles as relaxed as possible. Because if they are strained, it's going to collapse the veins, okay? And now, she's not going like this. We're going to do it like this.
I can't. Come on. Hold on, let me just get it out. Okay. Fine, thank you.
So I'm going to come over here and I can actually follow. So you see her subclavian is right here. See where it splits?
Yeah.
Mm-hmm.
What vessel is that coming off of it?
Thinking arteries.
See this vessel coming off right here?
Yeah.
What vein is that?
Axillary?
It's actually the cephalic.
Oh, okay. Got
Okay,
it.
which runs out here and
Runs out.
dumps in that way. Okay?
Okay.
So we're going to come distal. Distal to the branch of the cephalic is the axillary. Okay? So we're going to take that without and with compression. Color. And Doppler. Now does it ask for an augmentation at the axillary?
Yes.
We're going to go mid-arm and squeeze. So we have our augmentation.
Got it.
Okay?
Got it.
Now, from the axillary, this is kind of like I do on the leg, where I get through the pop and then I go to the ankle.
Mm-hmm.
I'm going to come down to the elbow.
Okay.
Because trying to follow these branches is going to be real tricky.
Alright.
So I have to go down to the elbow, and the first vessel I like to find is the brachials. Brachial veins, the easiest ones to find. Why? They run with an accompanying artery, and they're paired.
Okay.
Yes?
So they look like posterior tips.
They look like, sure, kind of. Here and here.
Here.
See them?
Yep.
So now, I know I have to do brachials, basilics, and cephalic, yes?
Yeah.
Mhm.
I like to do them in order, alphabetical order. So I'm going to do the basilic first. Now the brachials run down the middle, yes?
Mhm.
So the basilic's going to be more
Medial.
medial. So let's come medial. That's the basilic.
Oh.
See how much bigger it is?
Yeah.
That's why most IV starts end up being in the basilic, because look how big it is. So these vessels, usually they're going to want them documented mid-humerus and at the elbow, okay?
Okay.
So I'm going to come up to mid-humerus, and look how close they are. They're not that far
Mhm.
apart, are they?
No.
I'm going to come up mid-humerus without and with compression. Color. Doppler. With augmentation. And where did I squeeze? I just squeezed your wrist, right? Anywhere in the arm will augment that vessel, right? I'm just going to go to the wrist and augment. So that's mid-humerus. Come down to at the elbow. Without and with compression. Color. Doppler with augmentation. Now we're going to come to the brachials. See, and her brachials are paired. But watch right here. There's three. They split. And then those two go back together. See that?
Huh.
Mhm.
That's cool.
So all the way down at the elbow. Without and with compression. Actually, wait a minute. Mid-humerus is first, isn't it? So we're going to come to the humerus. Without and with compression. Color. And here you really want to line them up. So you can pick up color in both of them. You can pick a color in both of them, right? And then I'm just gonna make our augmentation. Elbow, or mid-humerus, elbow. Now, cephalic. This is the trickiest one to find, okay? Easiest way to do it, have her roll her palm down. That exposes the outside of the arm. Go to the brachial. There's my brachial, right? Brachials are here, basilic is here.
Mhm.
Now I'm going to come out to the cephalic, bring my depth up, focus up, gain up. The cephalic is right there.
Oh my gosh.
See
Yeah.
it? See how superficial it is?
Mhm.
Well, that's what they talk about the greater saph.
It looks the same.
It does kind of look the same, but it runs very superficially.
Right.
Okay, and you can follow it all the way up across her shoulder and diving down into the subclavian, okay? So we're going to take mid-humerus out and with compression. Now, this one can be tricky to get color from. Sometimes drop our scale, color, Doppler. Okay, that's mid-humerus. And follow it all the way down to the elbow. Same thing at the elbow. Now, There's a branch that runs from the cephalic to the basilic. Anybody know what it's called? Median cubital. There, it's coming off right
Okay.
there.
Yeah.
That's your median cubital right there.
Oh,
And it runs at an angle like this.
yeah.
Okay? Now, last we're going to do is ulnar and radius. Or ulnar and radial. Okay? Now, we don't do an augment on these ones, okay? Just with and without compression.
Okay.
So I go all the way down to the wrist. And this is where pro pressure becomes critically important because these are super easy to compress. So we're going to come down to the radial.
Oh, they're so tiny.
See them? See how tiny they are? Without compression, come over to the ulnar. And it's easy, find the artery. If you see the artery,
You're
let up
close.
probe pressure because you're compressing the veins.
Yeah.
See the veins?
Mm-hmm.
Barely, because they're tiny, right?
Yeah.
With and without compression. This is why, if anybody tries to